Ill mental health will make our physical health worse or physical health conditions worse, and vice versa. Insecure parenting, harsh parenting, deprivation during childhood, incidents of bullying or abuse, they all contribute towards ill mental health. In Pakistan, we are now facing a very worrying trend towards increasing use of substances, and people don't realize that they can cause mental disorders also. The kind of challenges that Pakistan is facing, a lot of instabilities, economic instability, burden of mental disorders is known to increase to 1 in 5.
Hello and welcome to InferTalks, a podcast where I put you in the room with some of the biggest thought leaders from around the world. Today I have with me Dr. Asma Humayun, a member of the Royal College of Psychiatrists in the UK and has 30 years of experience in clinical care, capacity building, and service development. She's also National Technical Advisor on mental health for the Ministry of Planning, Development, and Special Initiative since 2021. She joins us today for two-part episodes dedicated to mental health. Dr. Asma Humayun, welcome to InferTalks.
Thank you.
All right, ma'am, let's go ahead and start our conversation. And on such an important topic as mental health, could you just go ahead and really unpack what mental health is all about?
Mental health is an integral part of our overall health and well-being. Like physical health, I think it will help if we imagine a continuum. On one side, there is optimum mental health, and then moving on to milder mental health problems, then to recognized mental health conditions, and then on the other extreme, the severe mental disorders that cause immense debilitation and suffering. Now, mental health helps us cope with the stresses of life. It helps us learn well, work well, fulfill our responsibilities, and contribute to our communities. I think it will be important for us to briefly discuss what mental disorders are, because mental disorders or illnesses, they are recognized states which are defined by clinical impairment of thought process, emotional regulation, or our behavior. And this can cause a lot of distress and suffering and impairment in functioning.
So let's say you were speaking or giving this example of a continuum. Let's say on my extreme most right, you have, I'm in the best most condition, to on my extreme left, a mental condition where I'm feeling more stressed, depressed, etc. Would that continuum look more like that from an expert point of view, or say, what would that actually really look like when you speak of a continuum?
Yes, on your right is the optimum mental health, and it's not absolute for any one of us. So we all oscillate on this continuum. So if there is a stressful period in life, we might move slightly towards the left. But sometimes people can develop conditions which are related to, for example, stress or milder forms of illnesses like mild depressive illness, and they are like in the middle of the continuum. But on the left side, there are more severe illnesses for which they need psychiatric care, and that's where most of the impairment of functioning is.
And so when you speak of mental health itself, how would it then really affect a person's way of life? When they're not feeling well, from a mental well-being perspective, how would it affect their overall day-to-day routine?
So not all conditions will cause such a remarkable impairment that they'll not be able to function. Mm-hmm. So many people, for example, have been under my care who are practicing doctors, or they have very responsible jobs and they can fulfill their responsibilities without any problem. But with severe mental disorders, there could be impairment in, for example, their personal routines, in their personal care.
And what would that look like?
For example, they might not be able to get up in the morning and have a bath every day. It's quite possible that they are unable to fulfill their domestic responsibilities, manage their relationships. For example, if there is a student, he might not be able to focus on his studies. Mm-hmm. A person might not be able to perform well at work. It can affect their ability to make decisions.
And somebody watching right now might think, there are so many other important things on the plate already. people are dealing with inflation, people are dealing with, say, issues like natural disasters, people are dealing with, so many kinds of different issues that they're facing, both as a result of, macro level impacts and also, with a lot of things that are taking place in their day-to-day life. Why in midst of all this should they really be concerned about their mental health then? Because they have so much of other things to take care of.
So, Usama, everything that you have said, it impacts and is impacted by mental health. So, mental health is like instrumental, it's like intrinsic to our well being. So, ill mental health can cause a lot of suffering. That's one reason. And this suffering is not just at an individual level, the whole family suffers. The second point is that people who live with mental health conditions face stigma, discrimination. They do not get the same opportunity to access services. They are prone to maltreatment, and therefore it's a human rights issue. The third reason is that there is a bi-directional link between mental health and physical health. So there are a lot of chronic conditions, chronic medical conditions, for example, diabetes, hypertension, even heart disease, tuberculosis, which have a direct impact because of the mental health, mental health.
So if I can stop you here, Dr. Asma. So what you're trying to basically say is that there is somehow I don't know whether I would say there's an equivalence between physical ailment and psychological or mental health disorders. If I say that, there is perhaps an equivalence, but then at the same time, will there also be an intrinsic relationship between the two?
Absolutely.
And how would that be?
So ill mental health will make our physical health worse or physical health conditions worse, and vice versa.
Could you give us some examples?
So, for example, if somebody is living with diabetes and develops depression, then that person might not be able to take care of their dietary restrictions. They might not be able to comply with medication. They might not be able to exercise regularly. So, as a result, their management of diabetes will be affected. So there's a bi-directional relationship between mental and physical health. So one affects the other and vice versa.
So what would a state look like where perhaps, taking care of your mental health could help you take care of your physical ailments as well? What would that look like? Or if there's any example that does come to your mind to that end?
So, for example, just like the example that we discussed, that if somebody with diabetes is living with untreated depression, it can become very difficult to manage that diabetes. But if we treat depression, then managing diabetes becomes easier.
So how, I know I'm not trying to catch you off guard, but how common have you seen this thing?
This is very common.
Even with patients in Pakistan?
Yes, even with patients in Pakistan. So I'll give you another example of cardiac disease, for example. People who suffer from a heart attack are likely to suffer from a moderate degree of depressive disorder. And if the depression is not treated, then the prognosis of their cardiac disease can be affected.
So what you're suggesting is that, for example, if your depression is not taken care of, if that has not been treated, it can affect your cardiac health as well. And the same goes for people who already have a risk of cardiac health, but they somehow develop depression, and it could affect or aggravate their cardiac health as well.
Yes.
That's very interesting. Now, let me go ahead and ask you another important question. Now, you've established this case for mental health itself.
Sorry to interrupt, but there are more reasons why mental health is very important.
And what would those be?
So we said it's a human rights issue. We said that it affects our physical health, but there is a huge economic cost to mental ill health. And this cost is not just the direct cost of getting treatment. A person with mental illness might not be able to work, so there's a reduced productivity also. So there's an economic impact on the individual and the family. And mental health is related to nearly all key development issues. So if you look at the SDGs, most of them are either impacted by or they impact mental health. So for example, poverty, hunger, employment, health, social justice, gender equality, all these are very, like close determinants of mental health.
So what you're suggesting is someone who is affected by, mental health anomalies would eventually have their financial productivity impacted as well.
Yes.
Like their ability to contribute to the financial well-being of the family itself will get acutely affected as well.
Right.
And so now, ma'am, let me come to this another important question that I was about to ask you. And now that you've actually established this case for mental health, what are some of the risk factors for mental health? What have you seen so far?
So the risk factors are a complex interplay between individual risk factors, families, factors related to the family, and structural factors around us. So, for example, I'll start with an individual and his development years. Insecure parenting, harsh parenting, deprivation during childhood, incidents of bullying or abuse, they all contribute towards ill mental health. In the same way, if a person is genetically predisposed, for example, if there is history of mental illness in the family, then that person is going to be more at risk for developing mental disorders. And as this person is growing up, problems with relationships, domestic violence, lack of employment, social adversity, exposure to trauma, all these are risk factors.
So a lot of those factors that you mentioned on earlier, we see them taking place quite at a very widespread scale, I must say. Not so widespread as to, being socially, in an endemic state. But the problem is that these are quite very common examples that you've actually cited, and they do occur at a very common level. How would you sort of emphasize that, creating or changing those little patterns in terms of how we deal with each other can contribute significantly in a different manner, say in terms of improving the mental health or the well-being of the family members or the individuals at large? I'm not including those cases where you have a more genetic propensity or, a genetic risk factor is involved. But other factors, where socialization is involved, where how family members are dealing with, their children or their other family members, which largely actually contribute to a lot of these issues. What would you say about that? Changing those little things that can either make or break the mental health aspect.
Sure. So everything that contributes to our resilience is important to protect our mental health. So basically, you're asking that what factors will help us develop our resilience further. You said that, we can leave aside genetic factors, but I am going to start from the genetic factors, because the awareness that there is history of mental illness in the family and how to detect early signs and seek help at the earliest actually can change the prognosis of mental disorders. And we can protect ourselves.
Can this be done?
Of course.
And how can that be done?
So all mental illnesses are treatable. And the earlier you detect them, the more effectively you are able to treat them. So genetics, I think, is important as protective factor also. But going back to the development years, when we were discussing the risk factors, in the same way, secure parenting, where there is emphasis on social and emotional development, where there is physical and emotional security and safety for the child, where there is attention to his physical health needs. All this will contribute towards building his resilience and, protecting his mental health. And as people grow up, then secure relationships, opportunities for, education, employment, social justice, integrity, social integrity, and, support strong social networks and support systems. All this contributes. Now, for mental ill health, there is a very direct relationship with poverty. And people who live in poverty state, they are at risk to go down a vicious cycle of disadvantage. So this, again, needs to be looked at. People should have, there should be equal opportunity and social justice around them. So this is how we can protect our mental health.
So I'll come to this bit as well, that, how your ability or your financial inability sort of aggravates your chances of getting resources to improve your mental health as well. That I will certainly come to. But a very common example that does come to my mind is that a lot of mothers and parents must be listening to this conversation, and they might think that it's easier said than done. They might say that it's quite very difficult to have a conversation or try to explain your children to do the right thing. Now, it's quite subjective what the right thing can be, or perhaps the means that are adopted to help them understand what can be the right thing or what exactly is the right thing that they're trying to convey to their children. But someone as a parent, but then someone who's had this exposure to the field of mental health, what would you suggest in terms of in terms of the tips to parenting to parents? What could they do differently to be better parents?
So, being a parent is a huge responsibility. And I would say that the first important point is that a parent should look after their own mental health. Ill mental health in a parent, I think, is detrimental to a child's development. The second thing I would say is that harsh parenting is probably very harmful. Inconsistent parenting is harmful. So, providing a secure framework for a child to grow and explore his potential is extremely important. So, like I was saying earlier, that sometimes parents themselves are not mature enough to understand what can contribute positively towards emotional and social development of a child. Sometimes parents can put undue pressure on a child to secure grades. Sometimes parents can be overly persuasive towards a child to select a career of their choice rather than the child's interest or abilities. Now, these are some of the areas where a parent, could probably be more careful. I also said that we need to provide some kind of safety, physical safety and emotional safety. So if there is, for example, domestic abuse or domestic violence, that can affect the child. Or if this is a large family and there are interpersonal difficulties, that can affect the child's health. Physically, the child needs to be protected. So if a child is left in an environment where he's or she is liable for abuse, that would be traumatic for the child and his development.
And so, Dr. Asma, let's come back to this this point of mental health disorders. What are some of the disorders that you see quite common these days?
So mental disorders are extremely common themselves. Before we get into the types of mental disorders, I'll just briefly say that 1 in 8 people live with a mental health condition. That means that every household, we have large families in Pakistan. That would mean that every household would have one person living with a mental health condition. Women are slightly more at risk for mental disorders than men, but the risk is not as much. For example, 13.5% of women live with a mental disorder, as opposed to 12.5% men who have a mental disorder. These are very big numbers. And therefore, the conditions that I'm mentioning now, they are very common conditions. First of all, stress-related conditions are very common, particularly, in the times that we are living where we see these humanitarian crises, climate-related disasters. We see there's economic crisis going on. People are extremely stressed and worried and frustrated. So stress-related conditions are very common. 30% of the population might be suffering from at least moderate levels of stress. Depression then is a very common mental disorder. Other than that, in children, I would say that developmental disorders, including intellectual disability, which was previously known as mental retardation, that's quite common. Emotional disorders, conduct disorders are common in children. Then there are some severe forms of mental disorders like schizophrenia or bipolar disorder. 2 to 3% of a population lives with severe mental disorders. In the elderly, dementias are very common. And I don't want to forget substance use disorders, because in Pakistan, we are now facing a very worrying trend towards increasing use of substances, and people don't realize that they can cause mental disorders also.
So let me then ask you about a few mental disorders. Like, what are some of the signs that people might need to look out for if they have these symptoms? And why is it important that, instead of just doing nothing about it, they should perhaps reach out for or seek professional help? Like, for example, people often speak about, I feel so stressed. So what kind of symptoms would a stressed person or someone who's under a lot of stress would experience?
Well, you are more likely to tell me about that, because each one of us has experienced stress. And when we are stressed, then that affects our ability to think. It affects our ability to work. It affects our ability, the way we feel, our behavior. So, for example, there are bodily symptoms of stress. So we can have palpitations, sweating. Some people will have problems with gastrointestinal functions. Dyspepsia is common. Some people will have vague body aches and pains. Some people will have headache. People might not be able to sleep as well. There might be changes in their appetite. And these are very closely related to depression symptoms also.
And what people might also be anxious.
Yes, people could feel like anxiety, or people could feel like a lot of worry, or people could feel a lot of tension. This tension could be converting into muscle tension also.
Right.
And these symptoms are very closely related to the disorder of depression.
And depression, yes. You just come across anyone out here, and anyone you would, very loosely use this term. I'm feeling depressed. They might be feeling a blue mood of sorts, but, people often very casually use this term out here in our society, or generally, if I must say. So what exactly is depression? Could you elaborate on some of those symptoms?
I think the word depression, this is misleading, because depression is an emotional state. It's an English language word that we use every day. So when you say that, half of the country is depressed, or, who's not depressed, that is an emotional state. But the depressive disorder, for that briefly we use the word depression, but it's actually a depressive disorder. And this is a characteristic set of symptoms which can be present for at least 2 weeks before you start considering that this is an illness. There might or might not be a recognizable cause to it. So sometimes people have depression and they say everything's going okay in life. So I don't understand why I'm unwell. Why am I depressed? There's no reason for me to be depressed. But this is a biological illness. So what it means is that if you have a strong hereditary predisposition, then you can have depression even if everything is going well in life.
What people might say is, perhaps due to neurochemical reasons.
Right,
perhaps.
right.
All right.
Right.
And then what other symptoms would, someone who's actually suffering from a depressive disorder might experience or face?
So the two core features are that there is a persistent feeling of sadness, low mood. The second feature is anhedonia, which is inability to experience pleasure. And then some very common symptoms include reduced interest, disturbance in sleep, disturbance in appetite, impairment of concentration, low levels of energy in the body, negative thinking. People, when they are, more depressed, then they can start experiencing hopelessness. People can start saying that there is no reason for them to continue living. People can even experience thoughts that they, should harm themselves, or maybe their life should end. And one of the most worrying complication of depression is suicide.
And so when you speak about all these symptoms, more or less, most of these symptoms should at least persist for a period of at least 2 weeks for it to be considered or diagnosed as a depressive disorder. And as you mentioned, not all of the people are likely to have suicidal thoughts.
No.
All right. What other disorder could have some closer resemblance to a depression? Are there other disorders that might have a propensity to get misdiagnosed with depressive disorder?
In Pakistan, or in countries like Pakistan, we tend to not present with very psychological symptoms or maybe depressed mood or sadness. Most times people present with bodily symptoms also. So you might have heard that nearly in every family there's somebody who repeatedly goes to doctors for investigations, and they've had loads of consultations, loads of investigations, and no cause has been found. These psychosomatic illnesses could present with underlying depression also. So this is called somatization, which means that the conversion of distress into bodily symptoms.
So while there may not be a presence of an actual ailment, a person somehow might feel that they're not doing okay.
So it is quite possible that there is some pathology, but the pathology is not so pronounced that they should have so many symptoms, but because of their distress, those symptoms are magnified. And therefore, a doctor on his regular investigations might not be able to find the cause.
And let's say, if people do experience some of these symptoms of all the conditions that we've discussed or some other complication, it's completely normal to visit a psychiatrist, just as it is okay to visit, say, a skin specialist, or let's say a gynecologist, or let's say a cardiologist. It's just completely normal to visit a psychiatrist when we are not feeling okay when it comes to our mental health.
Ideally, yes, but because of the stigma, this is not how it happens. You know that there are many barriers for us. As an individual, it's difficult for us to acknowledge that I might be mentally unwell. Unfortunately, there's a lot of embarrassment and shame associated with it. It is seen as a sign of weakness. And even if an individual is brave enough to acknowledge that, they have depression, then the family will give them 101 reasons why they should never tell anyone that they have depression or they have a mental illness. What if your work finds out? What are people going to say? What are going to be your chances for getting married? So these are some of the very real barriers. So it's not as easy for people to seek help for mental health, ill health, as it is for physical ill health.
So are there some financial aspects also involved that, people might think that, it's a very recurring service because you have to visit the doctor, you have to get time and again, psychological interventions as a result of therapy sessions. That might end up becoming a bit too costly for them. So are there other factors like the financial ones that might inhibit them from, reaching out to a psychiatrist or a psychologist?
I think it's important for us to understand that there is a very severe dearth of specialist services in the country. And the specialists who are present, mental health specialists, they are mostly concentrated in big cities. And those who are experienced enough, it is easier, unfortunately, to access them in the private care. So an ordinary person might have to travel for hours and spend thousands of rupees on traveling and then pay for this doctor's consultation. And the irony is that at the end of the day, this might be a very brief consultation, and he might just end up with a list of medicines without any psychotherapeutic input into that consultation. Now, if we look at the psychological services, they are not developed in Pakistan. So people who graduate as clinical psychologists, they start to work mostly without clinical supervision. If you look at the services for substance use disorders, there is a mushroom growth of drug rehab centers around us. Again, most of them are not working on scientific protocols. So all these services, whether it be a psychiatrist working in the private sector or a clinical psychologist or these drug rehab services, these are mostly unregulated.
And speaking of regulation, I think you've been working for far too long in this domain itself. What kind of challenges have you seen towards regulation itself? I mean, we don't have the right amount of policies. We don't have the right type of legislation. We've seen people, I don't want to quote names, but we've seen people, abuse these loopholes and then, perhaps do some of the most worst things that they could to their beneficiaries as well. Because at the end of the day, they're not trained to do their job.
So this is a very serious issue. I mean, although we drafted the mental health ordinance for Pakistan in 2001, which was then the federal mental health, which was then the National Mental Health Ordinance, and after the 18th Amendment, it became the provincial mental health acts. On ground, there is very little implementation of these legislative, documents, and as a result, there is very little that is being done for regulating the services. So there's a huge gap there.
Right. And now let's speak about the most vulnerable groups. What kind of people would be the most vulnerable in terms of being affected by such disorders, and then at the same time not have the resources to get the kind of services that they really need in order to, be back in normal state of well-being?
The people who are living with socioeconomic deprivation are extremely vulnerable. Not just because the risk of developing ill mental health is very high, but also because of their inability to access credible service. Women and children are vulnerable, and I'm going to give you an example for women because more than 10% of women who become pregnant or have childbirth experience depression. And this is mostly unrecognized in our country. For children, I'll tell you that, 14% of adolescents between the ages of 10 to 19 live with a mental disorder. And we have no service for children and their mental health in the country. And what is more important for us is to understand that nearly half of the mental disorders have developed, or there are some early signs by the time a child is 14.
And so before I speak of the children, you did speak about mothers as well. What kind of disorders might they experience, right after, say, giving a birth to a child? What kind of complications are they likely to face?
So postnatal depression and postnatal psychosis, they are very common illnesses, but sometimes they tend to become very severe. And the complications there, a great worry there is that if a mother is suffering from a severe form of postnatal illness, then she could actually have these very negative, very worrying ideas that the world is not a safe place for her or for the child. And there is this risk that she might end up harming the child or harming herself or harming both. So postnatal illnesses should be taken very seriously. But unfortunately, the fact is that the services which are offering care for mothers who have childbirth, the obstetric services, they do not recognize depression, most of them, and they do not offer treatment.
So on one hand, one can understand the deficiency that there is in terms of, treating problems like these. But let's speak of our society itself. How does a common household try to actually mitigate a situation like this if they see a new mother with a newborn? What kind of advice do you usually see them giving to new mothers or to mothers in situations like these? And that ends up sort of becoming a barrier to reaching out to doctors like you.
I think what is important is that there's such widespread ignorance about these disorders that most of the behavior which is unhealthy is assumed to be a normal process after delivery, and she'll get better, and this happens to everybody. There is no reason to fret. They are ignored.
All right.
Sometimes there are very supportive families.
So it's considered like a usual business.
Mostly. If the family is extremely supportive, then what they do is they step in to help the new mother. And they provide all kinds of support, because of which, the symptoms get a chance. There's some space for her to recover also. But sometimes giving medicine, for example, is very important. And this is usually missed. And as a result, the first year of child's development, which is extremely important for a mother and the child bonding, that can be adversely affected.
So what you're suggesting is that problems like malnutrition can also be aggravated as a result of, this challenge that is or perhaps might be faced by mothers?
Yes, it is possible.
So what do you think should doctors be doing in that case? Shouldn't they really be advising families or advising the mother that they should be on the watch out for symptoms like these. If they do experience this, they should reach out to a psychiatrist. Do they usually do this, or they don't do this?
Absolutely. So all mothers who give childbirth should be screened for depressive illnesses. They regularly go and see somebody, or somebody, maybe a lady health worker visits them at home.
But my question is, do doctors usually give this advice to mothers to, sort of help bring this awareness to them or that insight to them?
No,
or they usually don't do this?
They don't, unfortunately. Doctors themselves are not very aware of mental disorders.
That's very interesting, but then at the same time also alarming. Especially for a country where we have such higher proportions of malnutrition among children of younger ages. Now let's speak of disorders in children. What kind of disorders are mostly common among children that you spoke of? That there's quite a good percentage of children that are struggling from problems like these.
So I think one problem that I would like to mention is that of intellectual disability. And unfortunately, in low and middle income countries like Pakistan, the great burden of intellectual disability comes from these countries, because in the developed countries, they have taken measures to prevent learning disability now, or intellectual disability. But in our context, I think we still have so many children and they remain unrecognized, undetected. Their learning disability is not discovered. So, for example, I clearly remember that when we were working with the IDPs from North Waziristan in Bannu, I remember seeing a father there who had 3 children who had learning disability. And he had spent back then, he had spent 18 lakh rupees on investigations, including MRIs, and he was running from pillar to post, and no doctor had even told him that the children have learning disability. So an average doctor is not aware of the milestones of development, that a child should be able to sit by 6 months and should be able to walk at this age. So therefore, because they are not aware of the milestones, therefore it goes undetected till the child is sent to the school. Then in the schools, unfortunately, sometimes teachers do not pick that a child has learning disability. And as a result, more harsh treatment is given, even physical punishment is given to a child who's not apparently paying attention to schoolwork or homework. And because of this pressure, the child develops emotional difficulties also. So
on one hand, he has a learning, or she has a learning disability to deal with, but then on the other hand, they have another emotional problem to deal with at the same time.
And because the child is not very expressive, so therefore that emotional distress it becomes amplified in the form of difficult behavior. So the children are then told off for being difficult, for being, stubborn, for not listening to the parents. There is even harsher response from the parents, who themselves are very frustrated by this time.
It's quite very interesting.
So the child is now struggling at school, he's struggling at home, parents are frustrated, and all we need to do is for an average doctor in the primary care to recognize that this is learning difficulty and to counsel the parents for treating him scientifically.
And then now let's speak of another important issue. And this is about, different kind of crises that our nation is usually facing. Let it be the ongoing economic issue that we are facing, be it, climate-induced disasters such as floods, or be it issues such as the one being faced at the hand of debilitating law and order. Mostly we see the emphasis, even in public discourse, being on the on the number of victims, on the number of cases, etc. But we hardly ever see any emphasis on the people themselves, the kind of struggles that they are actually facing as a consequence of most of these issues that we've just faced. Like, take for example, how the ongoing issue of electricity bills is wreaking havoc on people's mental health well-being. we hardly ever see any conversation on how has it affected people's psychological condition, etc. It's mostly, the discussion is mostly on the macro level issues. What would you suggest that why is it important that we should be emphasizing on people's mental health well-being as well? Like, for example, we had floods last year, but there was hardly any emphasis on how many psychiatrists do we really need to get out in order to make sure that there's a traumatized segment of population that we need to make sure should be able to recoup with some of the trauma that they've actually faced.
So you remember I said that 1 in 8 live with mental disorders in life. Mm-hmm. But when there is a situation like you were describing, maybe post-natural disaster or because of prolonged conflict or because of the kind of challenges that Pakistan is facing, a lot of instabilities, economic instability, the burden of mental disorders is known to increase to 1 in 5. So 20% people who are living in such adversity can experience a mental health condition. This is very high. So most people will have resilience and they'll cope with their problems, but 20% of the people will fall unwell. They will develop a mental health condition and will need help. In addition, those who are living with pre-existing mental disorders are very much at risk to develop a relapse, or their conditions can worsen. So even that becomes very challenging. The third reason is that newer problems, like, for example, addictive behaviors, problematic use of substances that can cause addiction, they can crop up under situations like this. The incidence of violence that rises. There's the risk of abuse towards children that increases. So there's a lot of worry. Even the frontline responders, people who are trying to offer frontline services, they are high at risk of developing mental health conditions themselves, both in the short term and in the long term. So I think it's an extremely worrying situation. And you mentioned the floods. We keep on, hearing these reports from different parts of the country. 10th September was World Suicide Prevention Day. And there was one very elaborate report which has come out from Thar. This has been going on. We have known the risk of suicide there, high rates of suicide being reported for some years now. Then there was another report that I saw from Balochistan, where in particular areas affected by a flood, people have not been rehabilitated so far, and there are worrying reports of their ill mental health, how they are suffering. And there have been other reports of, increasing reports of suicide in Balochistan. Similarly, we have known that Chitral is known for high suicide rates. So although you were right in saying that we have not been paying enough attention, but it is not that we'll be able to ignore this for much longer, because we have already started seeing the consequences of ignoring mental health support.
So have you seen any signs of concern and the much needed reason or promptness for action by local governments to intervene or do something about it? Have you seen any indication towards that end?
There is some movement. There is some developments, and I hope that in the second part we'll be able to discuss more of this. Mm-hmm. This is what is the core work that I have been doing for the last 2-3 years. So no, there isn't enough service at the moment, mm-hmm. but what can be done and what should be done, I think we've started to understand that.
Let's speak about another elephant in the room, and this is about the issues, the delicate issues that are actually discussed in media itself. For example, take the example of suicide, sexual violence, child abuse. We often see media often trying to sensationalize some of these very serious issues instead of reporting in a responsible manner about them. My question then is, have you seen any improvement on that front in the media itself, or you still tend to see that inclination or that that propensity to sensationalize these matters more than resorting to a more somber or a serious discourse while reporting on these issues?
So there's good news and there's bad news. The good news is that, at least there are reports now. At least we have started discussing that these issues exist. The bad news is that I don't think there is any scientific training of people who report such incidents in the media. There's no formal training for these journalists or reporters. You very rightly pointed out that these are very extremely sensitive and delicate matters. The responsibility of reporting a suicide is not just about conveying accurate information like other news, for example. Here, the responsibility is that you should be, sensitive and empathic towards the surviving family also. Also, you want to make sure that people who are vulnerable, people who are at risk for self-harm and are watching these news or reading about these news should not be able to relate to either the victim or to their circumstances. And therefore,
Why is that the case?
so for example, mentioning the means of suicide or mentioning, what the situation was. For example, many a times you read that this person was unemployed, or there was marital discord, or this child or this young person failed an exam. Now, this is misleading and oversimplified explanation as a cause for suicide. Suicide is a very complex issue. And normally there is, loads of factors, layers of reasons, including genetic factors, including psychological difficulties, including social factors, which contribute to a point that a person then starts to think about ending their life. The last precipitating factor or the event could be one of these causes. But to write that a person has ended his life because he was out of job means that everybody who's out of job will start thinking about that. In the same way, for example, if somebody is not aware of how they can end their lives and they read about a method which sounds or comes across as extremely effective because this other person instantly died, then I think that's quite harmful, or that there is risk of causing harm there.
Then the question that really comes to the mind is, what then really is the purpose of reporting issues of suicides itself, or reporting on incidents of suicide itself? What should the sole purpose be of any media entity or any reporter that is actually reporting on these issues?
I think this is a very good question. You see, when suicides were not being reported, then even a single incident was given a lot of sensation, and it was like put a whole story on the front page or whatnot. But right now we know that there are about 20,000 suicides, at least 20,000 suicides happening in Pakistan every year.
Every year.
Every year. Now, what that means is that in any particular day, there are at least 50 people who are losing their lives to suicide. And therefore, we have to go beyond just reporting it. And this is an opportunity for the media to educate people. What are the risk factors for suicide? What are the warning signs? What are the symptoms that people should be alarmed? How to approach people who are distressed? You see, for every person who dies by suicide, there is at least 10 to 20 other people who are thinking about it. And they are reading or watching these news very closely. So for us to explain that, somebody can seek help, and what are the sources of help? For example, people might not think that going and seeing a doctor is the appropriate thing to do. People might not know that if I have not been sleeping, then this is a sign, this could be a sign of an illness. People might not know that this illness is completely treatable. So I think every time there is a suicide, that opportunity should be utilized to educate people and to help them, guide them towards sources of help.
And then I might also, try and throw an example of the entertainment industry itself. We've also seen it, come up with often stories based on traumatic events itself. Do you think, is that something where the entertainment industry should also do some soul searching? I do understand that it's not completely possible for the media industry, and especially the entertainment industry, to go about that altruistic route. But what kind of soul searching should it really do to make sure that it is not in the process of, triggering traumas among the most vulnerable segments of the population?
I think this is also a very good question. You see, the point is that I don't think it's about soul searching. I think it's about being scientific. So, training and scientific guidelines and regulations are extremely important. And because these events are so commonly happening around us in the society, so they're bound to be matters of discussion and subject, not just the entertainment industry, but also on social media. And what is important is for us to understand that we have to, for every time we are portraying such an incident or such a victim, we need to ask ourselves this question, that what is the objective of this? So it is important to, for example, address the myths, blaming a woman who has been victim of sexual violence, for example. So if the media can help us dispel that myth, and they can maybe educate the audience about the positive behaviors, that how do you talk to a person who has suffered violence? How do you support a person? Can you offer some help? And to focus on how, the survivors recover from such trauma. This is extremely important. Focusing on what helped them, what kind of support helped them, how did they gather the courage and recovered and resumed their lives.
So, Dr. Asma, before we wrap up the first part of this conversation, my last question for this part is that you've actually been working for the last 2 decades to raise awareness about the availability of resources on mental health. Could you actually tell us a bit about that? What have you really tried doing under those initiatives?
So for most part of my career, I mean, for the first 15 years after my training, and I returned to the country, for 15 years, I was working in the public sector. And I was actively involved in undergraduate medical education, postgraduate medical education. So that's where I started from, teaching medical students, teaching psychiatrists. But following that, and with a change in my career, I started teaching clinical psychologist also. I started working in the humanitarian context, providing mental health and psychosocial support services. But more recently, the emphasis of my work has been on training primary care staff, particularly primary care doctors. How can we help them identify and manage common mental disorders? Because according to the WHO, 70% of common mental disorders can be treated in the primary care. So this is where I am focused at the moment.
So, Dr. Asma, we'll park our conversation here for now, and we'll rejoin you and have you over for our next part of conversation. Thank you so much for joining us today on InferTalks.
Thank you.
Thank you so much for staying with us through this conversation with Dr. Asma Humayun. We will join you again in a later episode about service gaps and the way forward. Our team works very hard to make this work possible, and it would mean the world to us if you could like and share our content to show your support. And if you'd like to stay informed on upcoming podcasts and other work, please hit the bell icon.